Welcome back to the In Chamber. I'm your host, Tom Schumann. Today, we're pleased to bring you the next in our series of conversations with the Indiana Chamber's 31st Annual Award winners. Now, when I think of doctors, sometimes in my mind, I place them all in maybe one category. Yes, I realize there are many specialists, but I guess I expect all of them to have some similarities, some similar, we'll call it tolerances in my word. So I was surprised a little bit when I read as we were putting together our Biz Voice magazine story on the 2020 Birch by Richard Lugar Government Leader of the Year. The winner told our Rebecca Patrick that she planned to be a pediatrician until, and I'll quote, until I saw all the vomit and the bad ears and the screaming kids and decided this is not for me. Instead, she opted to become an obstetrician and gynecologist, and in 2020, she is our state health commissioner leading our medical response to COVID-19. Dr. Kristina Box, welcome to the In Chamber.
Thank you so much, Tom. It's such a blessing to be here.
Well, I told a little story on you there about what you said, about looking at the pediatrician world. But if you would talk a little bit about why you decided on a medical career in the first place, what drew you to this profession?
So I had a sixth grade teacher who my entire health year was devoted to the human body. It was all the different systems of the human body, whether that was the reproductive system or, lungs or the cardiac system. And it absolutely turned me on. I absolutely adored every moment that I spent studying and learning about that and diagramming things out. And so from that time on, I said I was going to be a physician.
Did you ever follow up with that sixth grade teacher years later?
I have tried to find her multiple times over and asked because I would have loved to let her know the impact she had on my life. I have said it so many times, even when I've been back in Terre Haute, which was where I went to school for grade school and high school. And so I'm hoping that somehow it got back to her, but nobody's ever known how I could connect with her.
Yeah. So we'll get to 2020, obviously, and some of the things going on. But you've been a physician for over 30 years. So for over these 3 decades, talk a little bit about some of the major changes you've seen. What were things like in the late 80s compared to where we are today that have really struck you that stand out?
Mm-hmm. So, it's interesting. When I interviewed for medical school, I got asked a lot of questions about why did you take this course and why did you think this was going to be helpful and how did you do in this? And, I even bluntly got asked, why do you want to be a doctor? Aren't you just going to get married and stay home and have kids? And I was like, I just kind of at that stage, 30, I don't know how many years ago, 40 years ago, assumed that was normal. And I answered the questions to the best of my ability, got in, was accepted early. But I really got frustrated after I talked to my husband, who was applying at the exact same time, whose credentials were about the same as mine, that he talked about IU football and basketball the whole time. So it was an eye-opener to me. I can tell you that when I first started, we had 3 women out of my residency program that were in the OBGYN program out of 7. And then now pretty much you see it's all women for the most part, or with an occasional male there. So there's been a lot of changes in the number of women in medicine and specifically in my surgical subspecialty, which is OBGYN.
Well, that's a good segue to, before becoming health commissioner, the last 5 years or so with community health, you really focused on women's health issues. Talk about, give the listeners some idea there, some of the great advances that have taken place and kind of the passion for your work in that area.
So I think a couple of the biggest things that I've seen was learning to be able to operate with a robot. That was a huge change in my career and a huge learning curve for me. But again, it's less invasive and so remarkably better as far as women being able to recuperate and to do much better more quickly. And I think the second thing that I saw was we embedded mental health into our clinic. And that made a huge difference, Tom, in the number of women that actually accepted those services. So many times I had the discussion and I would give a referral. I'd even try to call and make the appointment for people. But when I could walk out of that particular exam room and say, hey, so-and-so's here. She could stop in. You can talk to her. And if you connect with her, maybe you'd like to come back and further discuss these issues that we've talked about. And our uptake rate just went through the roof on that. The other thing that we saw in obstetrics, and I think we've seen it for many years, but because we didn't really have a way to make a difference in it or impact it, was substance use disorder in our pregnant women and the effect that it was having on children. So at the same time, we were seeing these huge increases in overdose deaths. We were seeing similar issues with people having substance use disorder when they're pregnant in the childbearing years. So really worked very, very hard to make sure that our community health network was able to and interested in addressing that, and had a couple of physicians at Community Hospital East that were very, very engaged in that, built a program. The foundation there supported what we needed for additional social determinants of health support. So that we really started to look outside of just what are we doing in the clinic to what do we need to do to help this woman make sure that she can actually have transportation to get to her appointment, that she's going to have a roof over her head tonight, that she has food security for her children that are at home. And so those were really important things that we were able to transition and make sure we were addressing for people.
Are you encouraged today where I guess women's health is from a general standpoint? I know it's complex, there's so many issues, but are you encouraged, confident that we're definitely heading in the right direction?
Right. I'm extremely encouraged by what's happened and the changes I've seen. Women have driven healthcare decisions for families for a very long time. And so it's been really important to engage women so that we could get their husbands and their children and everybody else into care and make sure that we were providing the services and the needs for the whole family. I think that one area that I still think we really need to help with is our young adults that sometimes end up having an unplanned pregnancy and subsequently having children earlier in life before they finish their education or their job training. And I really want to help young adults see that we want to help them to get their training in and to be set so that they're emotionally, physically, and economically prepared to be parents.
All right, so we come to 2020, Dr. Box, and whether you like it or not, you've become a TV personality. Whether it's through the daily briefings, then weekly briefings, and certainly all the other work you do. But I'm going to ask you, what kind of feedback have you gotten from that, from friends, family, as you've been put into this much more public role? What are people telling you?
So, it's interesting because my closest family friends are, tease me a lot about it, but they're very, very supportive. They know it's probably my least favorite part of this job, the being out front person, being in front of a camera. That's not really where I'm most comfortable. A one-on-one situation like this with patients and family, or even with my sleeves rolled up and working with my team, is much more my comfort level. But it is part of the job that I signed on for. And the governor's office has been incredibly patient with me as I've learned how to do this job in a more appropriate, better manner, I guess I would say.
I'm going to ask you about teamwork a little bit. Certainly, it applies in so many medical settings. Obviously, nothing gets done in a silo or individually. But you're the government team that you have become so close with out of this pandemic situation. Talk about that team a little bit and how inspiring that is to work together on this.
Yeah. So I have an incredible team at the Indiana Department of Health. I could not be more blessed with everyone. And I don't even want to mention anybody specifically because every single person has been working, 24/7 basically to make this happen. But this wasn't just a Department of Health. I mean, the governor made it clear early on, we have everything, you have everything health at your fingertips to try to help manage this epidemic, including the ability to work with FSSA and Department of Corrections and work with Department of Transportation, whoever that is, we are going to be there and engage. And the governor made it very clear there weren't going to be any silos, that there wasn't time for silos. And so from the very early point on, we reached not only just internally to agencies, but externally to people like Fairbanks School of Public Health and Regan Street and MPH, and made sure that FSSA and IDOH's data teams were all working together to get the best data so that the best decisions, policy decisions can be made. And then, Jen Sullivan, and I are really good friends, and we just work really well together. She has been a blessing this whole time through, has taken on absolutely anything we've asked. She's loaned me multiple people from her agency to help fill out my team. Dan Rosiniak has worked with our long-term care division, and with Lindsay Weaver. And I would say that all the physicians that are employed by state government, whether that's through Department of Homeland Security with Mike Kaufman, whether that's been at FSSA with Dr. Sullivan, Dan Rosiniak, even CTSI has been incredibly important as we've worked through this with their physicians there. Amy Gilbert and the team there researching things in a moment's notice for us to help direct policy. And as things change, one thing we always say is the guarantee with this pandemic is it's going to change. What we say today is going to change tomorrow and the next day or 2 months from now.
It was fascinating early on to hear you and many of the other doctors you just mentioned talk about taking those emergency room shifts, being on the ground floor, the front line, so to speak, during this to have an even better knowledge of what was going on.
I think that's really critical. I think I haven't done a shift on the labor and delivery unit for probably a year now, to be quite honest with you, as busy as I've been. But Dr. Weaver, Dr. Sullivan, Dr. Kaufman, Dr. Rosiniak, they are all actively in the emergency room throughout the week, at least one day. And I think that inside knowledge of what's going on and what our hospitals are experiencing, what we're seeing in the emergency room, has really been critical as we've worked with our hospital systems and the Indiana Hospital Association, who has been an incredible partner throughout this entire process.
Well, Dr. Box, we are talking here in late October, a few weeks before our listeners are tuning in to hear this conversation. You are, we're happy to say, on the upside of your recovery from COVID-19. Talk about that situation a little bit and a little, how that obviously brought it home to you, having you and family members directly impacted by this.
Mm-hmm. So, it's really been interesting because my infection has been handled one of two ways. There are those individuals that say, well, see, masking and social distancing doesn't work because obviously we're going to just throw it out the window because Dr. Box got sick. And other people saying, well, they opened up and now there's all these infections and so Dr. Box is sick. But realistically, I got sick because the people that are in my social bubble that I let my guard down with, which has been my family for the past 8 months, we're together every weekend. And my little grandson, who I jokingly referred to as a bioterrorist because he's brought home every infection known to mankind.
Just like every other child.
Exactly. Another reason I didn't go into pediatrics. But realistically, I knew that would be, my biggest risk. And I did get infected and, we did everything appropriately. And so I guess what I would say is I was one of the people that was blessed. I did get symptomatic, but they were very mild symptoms. My daughter-in-law, my grandson have all gotten better. I am definitely on the mend and should be able to be back at work on Monday. I've been working this whole time, but back physically in the office on Monday. So I'm just very blessed, but unfortunately, not everyone is, and that's what we have to keep in mind.
Well, you mentioned a little bit ago of how this is changing and evolving so often. This may be the impossible question, but is there anything that has surprised you the most throughout this 8 months, approximately 9 months thus far, about dealing with this pandemic?
I think the biggest surprise to me is the somewhat overwhelming negative response to being asked to wear a mask. How that has just been so difficult for some people. And I understand that there's a small percentage of people that really physically can't. Maybe they have panic disorders or other things, but in a lot of other cultures and populations, masking during the time of influenza and other things is just a really common thing. I've worn a mask in the operating room for years. So it didn't seem like a big thing to me, but it has been pretty overwhelming for some people. So that's probably been one of the biggest surprises.
Yeah, I don't. I wonder. I've thought about that too. If it's just a combination of factors, whether throw the political factors in, throw the racial inequality factors that have come into play. It just seems like maybe they've all mixed together to kind of lead towards that reluctance that you mentioned.
Sometimes I think it's because so much of this is out of people's control, and that is one thing they feel they can control, their own personal right to put on a mask or not put on a mask.
Well, this is similar to what we just talked about, but in the business world here at the chamber, we hear all the time uncertainty is among the biggest challenges from a business standpoint of planning for the next, whether it's weeks, months, or years down the road. Is it fair to say that applies in spades here, so to speak, that the uncertainties not only throughout this, but also future unknowns make the job of you and the team just so challenging, I would think.
Yeah, it's been difficult to not tell people exactly what's going to happen, exactly how this virus will respond, exactly how people will respond, exactly who's going to get infected, exactly when we can quit wearing masks, exactly when the vaccine's going to come out. Those are just things that, we're a very immediate society, right? We have an infection, we want a pill to make it go away, and we want to get back on with our lives. And this just isn't one of those things that we can do. And the uncertainty around this, I think the frustration too is this fact that um, we don't have really that much more right now today to fight this infection that we did when we started all this back in February and March. Really, it is those same mitigation things, which just people are tired of hearing about, but that social distancing and wearing your mask and washing your hands and staying home when you're sick and getting tested and then quarantining and isolating. Those are the things that people are tired of hearing. They're exhausted with it. But really, that's what we have until we can get more people immunized. There's still a lot of talk about herd immunity, and we'll be releasing some information about our prevalence study soon. But even New York City, when they had all that horrible outbreak and so many people infected and so many people died, they didn't even get to 20% of their population that were actually showing that they had had the infection. And herd
Yeah.
immunity is considered 70%. So we'd have to have a lot of people die, even people that are not just in long-term care facilities, in order to get to that 70% herd immunity. And that's not an answer as far as I'm concerned.
Yeah, I can't say that I realized that the gap was that large. I think, what you just mentioned between the 20% in New York and the 70, but I sensed that it was a pretty big gap, and that is scary just thinking about that. You talked about some of the great people that you work with, but talk about the department as a whole a little bit. Obviously, COVID-19 is gaining the attention, but talk about some of the other priorities of the State Department of Health and things you are working on and the team is making great progress on.
Right. So I think that's really important to be able to recognize that a lot of things went on, like our Women's and Children's Division continued to provide vouchers for families to be able to get healthy food for women and for children throughout this whole process. And our SNAP benefits through FSSA and that program allotment through the State Department of Health was absolutely critical through this. Our children's special health care needed to go on and make sure that children had access to the medications, the hospitalizations, whatever they needed. And then, our efforts along maternal and infant mortality. Our Maternal Mortality Review Committee just finished up their first evaluation of the 2018 deaths and finished their report, had CDC review it, and we'll be releasing that data soon. And our infant mortality efforts, levels of care. We basically have now been able to establish levels of care for all of our level 3 hospitals and working on our perinatal centers associated with that. We've continued our implementation of our AIM bundles, which is, high blood pressure bundles and hemorrhage bundles to try to decrease morbidity for our pregnant women. We have continued to work with OB Navigator. That program was supposed to roll out to 20 counties this year, and we're going to actually get to 22 counties this year. And we're seeing great results as far as we're really reaching those higher risk minority populations that we really wanted to focus on. So there's been a lot of continued work that's gone on through my immunization and all of our maternal child health divisions throughout the agency. And then our regulatory division has been hugely involved because they regulate long-term care in hospitals. So they've been very intimately involved with this whole process.
Well, you're modest when it comes to that infant mortality rate, because if I'm correct, the statistics latest show the lowest ever infant mortality rate in the state. So that's something so
Right.
significant.
And I want to recognize that. And I was so excited. The governor came on with our Indiana Perinatal Quality Improvement Collaborative Committee and actually announced that data to them and really celebrated that with them. I think that the bigger celebration for me is that our Black infant mortality rate is at the lowest it's been in 10 years. The unfortunate thing is it's still about 1.9 times higher than our white infant mortality rate. So in no way, shape, or form am I taking a victory lap, or is our team taking a victory lap, but we do feel like we're moving in the right direction and want to continue to just expand the programming and work with our partners across the state, because our hospital systems, our community health worker programs, our nurse family partnerships, all of them have been intimate parts of improving this infant mortality rate.
So they may not have asked you about IU football when you were applying to medical school, but I'll ask you, what do you think about football getting back to business on the college level and certainly professional also?
Right. I think that the infections probably don't really occur on the football field. I think they occur in what happens on the weekends and in the evenings, and when they have training table together and they're all having a pizza together in their room, just like our infections in schools. We're not seeing infections necessarily in school as much as the after extracurricular activities and the athletic events. I think it is an important part of mental health for a lot of people. So I do support it. I haven't been real excited to see the number of schools that have their athletic programs at the expense of having in-person school. I didn't quite understand that, but again, those aren't my decisions to make, and they're made locally, and I respect everyone's decisions.
But away from the medical side of the equation, as I understand, you are a big football fan, and as your boss, Governor Holcomb, says, you're a huge racing fan also. Talk about some of the sports background there. What drives those passions and pleasures?
So, some of my most fond memories have been at IU football tailgates. I've always enjoyed that. My parents always went down. So from the time I was in school to even after I graduated, that was a way to get together. And my sister went to IU. One of my brothers went to IU. My nieces and nephews have gone there. So it was kind of a way to kind of get the family together and enjoy time. And I've really enjoyed watching football. My son was a football player, and both my brothers were football players. So spent a lot of time watching the game and enjoying it. As far as racing, I have gone to the Indianapolis 500 for a lot of years, been to some NASCAR races too, even traveled to other states to see different races. It's something my brother and his wife and my husband and I enjoy doing together. So I kind of every now and then send information about Jimmy Johnson or whoever is, now going to be driving for IRL. I just find that interesting and fun.
So I've done the same thing. My wife and I went to some NASCAR races in different parts of the country. Any favorite tracks you've been to, or some of the favorite drivers that you followed?
Yeah, a lot of different drivers. I really enjoyed Texas Motor Speedway because if you set up high enough, you kind of see the entire track all the way around. So that was a really a fun and interesting race.
And if you're looking to go to another one, if you want to see everything, go to Martinsville, where it's only a half mile.
Oh, wow.
It's not easy to get to Martinsville, Virginia, but once you're there, you can see everything. It's quite interesting.
I'll have to put that on my list.
So we talked about, and you've talked during the course of this year, but some of the ways that you relax, that you get away from the stress of your position. It is so crucial from a health standpoint, but also from a personal standpoint, with some of the things you like to do that to help your health.
Mhm. So, number one, my family, that has been my savior. That's my bubble, my social bubble. My husband and I are not big socialites otherwise. So pretty much every weekend there's a family meal, 1 or 2 days on the weekend. We have a little grandson who I absolutely adore, and we love spending time with him. Um, I love to exercise. That is my stress reliever. I go down there and pound out a lot of heads on that treadmill. So I actually get through a lot of things, which is good. Um, and then really my relaxation and wow, this is my total Zen place is when I go to some of our national parks. I love to hike. I am one of those hikers. I'm not the backpacker hiker. I love to walk miles and miles and 12 miles, 16 miles, whatever it is. But I really enjoy coming home to a warm shower, nice meal, and maybe a bourbon and ginger ale.
Yeah, that's in our Biz Voice story too, and then we'll encourage our listeners to read. They can find out some of those favorite places that you like to go. Well, we'll leave that for the reading audience. As we wrap up, last couple questions. One, in looking ahead, I know that it is so difficult. You're looking at like yesterday, today, and tomorrow, and in a lot of cases. But even as you think about maybe 2021, how do you kind of capsulize now what you hope to see happen in these months ahead?
Right. So, of course, the prayer right now is for several vaccines that not only show promise, that actually are stimulating an immune response in people, but show a lasting immune response. And then the safety margin that we hope and pray to see with that, and that we get a good uptake of that. A lot of people have said to me, well, once I get my vaccine, then I don't have to wear my mask. And I'm like, you know what? We get an influenza vaccine every year. And I can remember having mine, in early November and being sick as a dog in December with influenza. So I didn't end up in the hospital, thankfully. And I think that's, it was a shorter infection, probably less infection than I would have had because I got the immunization. But realistically, I think that we're going to need to continue to protect ourselves. And if you look at vaccines, even influenza vaccines, they're perfected every year. So this vaccine or these vaccines that we have for COVID-19, SARS-CoV-2 will continue to be perfected in 6 months and a year, and we will continue to do that. I'm hoping that by this time next year in September, October, getting your COVID vaccine is just a routine thing, like getting your influenza vaccine. But we're going to have to see how that vaccine rolls out. I do think that this is going to, capture the headlines for a long time to come, probably next year at this time. And I heard Dr. Fauci say, somebody said something about, well, when can I go to my movie and have popcorn? And he said, about this year next time. And that was the end of September, October. So I feel like, we want to get back to normal, but I think that we've got some time yet.
And maybe in that time frame, next September, October, you can work in some IU tailgates too, hopefully.
Absolutely. I'm hoping for that, and maybe a nice long trip to one of our national parks for some hiking.
All right. Well, we've talked about a lot of obviously important things from your career and things you enjoy to do. Final question we ask everybody this year, whether you're looking at it personally, professionally, at the end of the day, what makes a great day for you?
Wow. Gosh, that's such a hard thing.
I know there's so many places to go with that.
Right. At the end of the day, I think what makes a great day is if I feel like I've connected with my team, whether that's internally or internally within the government, our external partners, and that we all seem to be rowing in the same direction. We're communicating the same things, we are working on the same things and going forward. And then, having that connection with my family, which they're great to keep up with me and how I'm doing. And so that's my world right now, and I'm very blessed.
Yeah, absolutely. Well, Dr. Kristina Box, thank you so much for joining us. Obviously, thank you for everything you are doing, and congratulations on being the 2020 Bayh-Lugar Government Leader of the Year.
Thank you so much, Tom. It's such an honor. I really accept that, really, in the name of a very, very large team out there that's contributed to this response.
All right. Thank you once again. Well, we're sure you've enjoyed our conversation. As mentioned, this is the second in our series of 4 with our annual award winners. We heard from Dave Ricks of Eli Lilly last week. And coming up on November 20th, we'll be talking with Brad Bostic, the Dynamic Leader of the Year. And on November 24th with Fort Wayne Mayor Tom Henry for Fort Wayne as the Community of the Year. So again, we encourage you to enjoy all these and previous conversations. Our November issue of Biz Voice magazine is available in print and online with more in-depth information on all the winners and additional stories on longtime chamber members. As always, thank you for listening to the In Chamber.